Hi friends, as you all are aware that we have very limited time now for the preparation for the upcoming JIPMER examination, which is scheduled on 18th of this month. So keeping this in mind, we are in our series, that is a JIPMER series, which will help you to prepare well for the upcoming JIPMER examination. Not only for the JIPMER examination, but also for other competitive exams like AIMS, then ESIC, etc. So as you all know that I have told in the beginning of the series, we can't expect what type of questions we can expect in JIPMER examination, but definitely these questions will help you to identify in which all areas you are poor and which all areas you need further clarifications. Okay, so straight away we'll move on to today's video. So once again, welcome you all back to our channel, the Nurse channel, and this video also contains 20 questions. In that 5 questions are from GK and the other 15 questions which are taken from different areas of nursing subjects. And straight away we'll move on to the questions. Before that, I remind you one thing, like if you are not subscribed yet to our channel, kindly subscribe and support us. So straight away moving on to the questions. So moving on to the very first question in this series. So the first question is in your screen right now. And the question is, which among the following is the antibiotic of choice for gonorrhea? So which among the following is the antibiotic of choice for gonorrhea? And the options for you are option number A, penicillin, option number B, tetracycline, option number C, ciprofloxacin, and option number D, ceftriaxone. So just think about the causative organism for gonorrhea and you can find the answer. So what is the answer? So the answer for this question is option number D, that is ceftriaxone. So we know that gonorrhea, it is a sexually transmitted infection and which is colloquially known as the clap, is caused by the bacterium Neisseria gonorrhoeae, and the infection may involve the genitals, mouth, and or the rectum. Okay, so the antibiotic should target the all strains of Neisseria gonorrhoeae. Okay, so due to the emerging strains of drug-resistant Neisseria gonorrhoeae, the Centers for Disease Control and Prevention recommends that uncomplicated gonorrhea are treated with the antibiotic ceftriaxone given as injection with oral azithromycin. Okay, so ceftriaxone and azithromycin are the drug of choice, and in that ceftriaxone is given as injection while the azithromycin is giving as oral, and it is the recommendation by Centers for the Disease Control and Prevention. Okay, so I think the first question itself was very useful for you. Now we will move on to the second question in the series, and the question is regarding the blood transfusion, and the question is, what will happen to the patient if whole blood transfused exceeds 4 hours in room temperature? So the question is, what will happen to the patient if whole blood transfused exceeds 4 hours in room temperature? And the options are option number A, hypokalemia, option number B, hyperkalemia, option number C, hyponatremia, and option number D, hypernatremia. So which electrolyte imbalances can happen if blood transfusion exceeds more than 4 hours? So that's a question for you. So you know that one of the complications of blood transfusion is one among the option in this. So the answer is option number B, that is hyperkalemia. Okay, hyperkalemia can happen. So in the explanation section, I will be explaining about this hyperkalemia and how we can treat for this hyperkalemia. If accidentally the blood has transfused for more than 4 hours, then what we have to do, that also I am explaining in this. So the clinical hyperkalemia, which results from RBC transfusions, has been recognized as a transfusion complication for decades, and there have been reported cardiac arrest attributed to transfusion associated hyperkalemia. Okay, so we know that when there is a hyperkalemia, there are chances for the cardiac complications like arrhythmias, which are life threatening. So guidelines say that a blood transfusion should generally take a couple of hours with a maximum of 4 hours. Okay, so this is the answer for another question which can be asked, which is a general easy question. So our aim is to, if something happens, then what we have to do. So The treatment for this is the intravenous administration of a solution consisting of dextrose in water. Okay, dextrose in water, that is 5%, together with fast acting insulin. So what is the role of insulin? Insulin will reduce the hyperkalemia. Okay, that mechanism I am not going to explain, that you can refer later. So insulin will reduce the high potassium levels, and discontinuation of the angiotensin converting enzyme inhibitor medicines if patient is taking. That means the ACE inhibitor medicines can also cause hyperkalemia. So if the patient is taking ACE inhibitors, then we have to instruct the patient not to take that tablet also. Okay, and restoration of the blood volume in order to improve the renal function. Okay, so because of hyperkalemia, that it can affect the GFR also, then the renal perfusion will be reduced, so other complications can also happen. So we have to restore the blood volume in order to improve the renal function. So these are the treatment modalities if the blood transfusion has exceeds more than 4 hours. Okay, so that was the second question. Now we will move on to the third question, and the question is, how will you position a patient for internal jugular catheterization? That means internal jugular central line. This is not applicable for all central lines. I am particularly asking for internal jugular catheterization. That is a question for you, so don't be confused. So the answers or the options for you are option number A, supine, option number B, Trendelenburg, option number C, reverse Trendelenburg, and option number D, Fowler's. So in which position you will position the patient for internal jugular catheterization? So what is the answer? So the answer for this question is option number B, that is Trendelenburg. Okay, Trendelenburg is the answer, and we know that the patient should be positioned in the Trendelenburg position for the internal jugular, or we have to keep the patient supine or flat for the common femoral vein or subclavian axis. Okay, so for the subclavian axis and femoral axis, we have to keep the patient in the flat position, and for the internal jugular catheterization, we should keep the patient in the Trendelenburg position. Okay, so that may confuse you, but be careful. Okay, now we will move on to the next question in our series, that is the fourth question. So this is regarding pain, and it is very, very important. So the question is, dash is pain experienced in response to a normally painless stimulus? So the question, you should read the question very carefully. The pain experienced in response to a normally painless stimulus. So what is that pain called? Okay, so the options for you are option number A, Allodynia, option number B, phantom pain, option number C, nociceptive pain, and option number D, breakthrough pain. So which is the pain which is experienced in response to a normally painless stimulus? So the answer for this question is obviously option number A, that is allodynia. Allodynia is the pain experienced in response to a normally painless stimulus. Okay, and it has no biological function, and it is classified by stimuli into dynamic, mechanical, punctate, and static. These are the classifications of the allodynia. So it is a pain experience in response to a normally painless stimulus, and the classifications are like dynamic, mechanical, punctate, and static. Okay, so in detail I am not explaining about allodynia. You can refer it later because we have very limited time. Okay, so the other options I will explain. So what is a phantom pain? What is phantom? Phantom means it is a pain that is felt in a part of the body that has been amputated, or from which the brain no longer receives signals. Okay, so amputation, that is a key point in the phantom pain, and it is a type of neuropathic pain. Okay, so that is a pain felt in the part of the body that has been amputated. Okay, so that is phantom pain. Then what about this nociceptive pain? That is the actual pain what we are explaining. So nociceptive pain is caused by the stimulation of the sensory nerve fibers that respond to stimuli approaching or exceeding harmful intensity, nociceptors, and may be classified according to the mode of noxious stimulation. Like it can be classified into thermal, that means heat or cold, then mechanical like crushing, tearing, etc., and chemical, that is a chemical induced. Okay, so this is what is called as the nociceptive pain, which is caused by the stimulation of the sensory nerve fibers. Okay, so that is nociceptive. And the final option was the breakthrough pain. What is a breakthrough pain? So breakthrough pain is a transitory pain that comes on suddenly and is not alleviated by the patient's regular pain management medications. Okay, so pain will come and suddenly the pain will come and it will not alleviate with the regular pain medications or pain management. That is known as the breakthrough pain, and this is very common in cancer patients. Okay, so that is breakthrough pain. Okay, so from this question you are getting four different types of pains, and I think that also is useful for you. Okay, now we will move on to the next question, that is the fifth question. It's a GK general knowledge from very important. So which was India's first developed and homemade fighter jet? So which was India's first developed and homemade fighter jet? Sorry, the was repeated here. Which is India's first developed and homemade fighter jet? So the options are option number A, Tejas, option number B, HF-24 Maruth, option number C, Dassault Rafale, and option number D, Sukhoi Su-30 MKI. So which was the India's first developed and homemade fighter jet? That is the question. So the answer for this question is option number B, that is HF-24 Maruth, which is made by the HAL, that is Hindustan Aeronautic Limited. It was the India's first developed and homemade fighter jet, and it was also the first Asian jet fighter to go past the test phase and was on active duty for almost 25 years. Okay, so I think that also is a very helpful question for you. Now we will move on to the next question in our series, that is the sixth question, and the question is, rectal temperature measurement is contraindicated in which all cases? Okay, so we know that rectal temperature is the gold standard method of checking temperature accurately, so but it is contraindicated in some cases. So the question is regarding that, and the options for you are option number A, neutropenia, option number B, myocardial infarction, option number C, HIV or immunocompromised patients, and option number D, all the above. So in which cases the rectal temperature measurement is contraindicated? So this is for a study purpose I have included this question. So obviously the answer for this question is option number D, that is all the above, in neutropenia, myocardial infarction, and in the HIV. Why? So that we will be explaining now. Taking temperature rectally is contraindicated for patients with MI or myocardial infarction because inserting into the rectal temperature can produce vagal stimulation, which results in the myocardial damage, further myocardial damage. Because of vagal stimulation, we should not introduce thermometer into the rectum. Okay, so that is one reason. For the other patients, like other options, we should avoid in neutropenic patients and the immunocompromised patients, because in whom the rectal manipulation may seed the blood with bacteria. Okay, so the rectal manipulation, we can induce bacteria along with the blood, and this rectal temperature measurement to be avoided during neutropenia to prevent colonizing gut organisms from entering the surrounding mucosa and soft tissues. Okay, so that colonizing organisms will be there, so there are chances like we can mobilize them from that area to the surrounding mucosa and soft tissues. So we know that already the patient is neutropenic and the patient is immunocompromised, and there are chances of getting infection. So that is the purpose we are not using rectal temperature measurement in these patients. Okay, so that's all regarding that question. Now we will move on to the very next question, that is the seventh question, and it's an application level question, and it's very easy but slightly confusing. So read the question very carefully, and the question here is, patient reports to have an inability to delay voiding long enough to reach a toilet after the patient feels a sensation of bladder fullness. Which type of incontinence this patient has? Okay, so here the complaint of a patient has been depicted here. So the question you should read carefully. Here the patient is reporting to have an inability to delay voiding long enough to reach a toilet. Okay, so that much problem is there. He can't reach the toilet, and after the patient feels a sensation of bladder fullness. So what type of incontinence is this? That's a question for you, and the options are option number A, stress incontinence, Option number B, urge incontinence. Option number C, overflow incontinence. And option number D, functional incontinence. So if you know the definitions or the meanings of these four terms, you can answer this question very easily. And I told in the beginning this is slightly confusing. So we will see the answer for this question. Here the answer for the question is option number B. Obviously that this is urge. The patient is experiencing urge incontinence. So we will see what is an overactive bladder or OAB. So it is a condition where there is a frequent feeling of needing to urinate to a degree that it negatively affects a person's life. Okay. So that is known as the overactive bladder. Overactive bladder means it is a condition where there is a frequent feeling of needing to urinate to a degree that negatively affects the person's life. So the frequent need to urinate may occur during the day and in the night or both the timings. Okay. So if there is a loss of bladder control, so in this case, if there is a loss of bladder control, that means the patient is unable to before reaching to the bathroom, patient pass the urine. That incontinence happens because there is a loss of bladder control. Then it is known as the urge incontinence. Okay, so I think the question and the answer for the question, I think it is clear for you. Now we will move on to the other options for this question. What is a stress incontinence? So stress, as the name indicates, stress. So it is due to a poorly functioning urethral sphincter muscles, that is intrinsic sphincter deficiency, or to the hypermobility of the bladder neck or the urethra. So as the name indicates, whenever there is a stress happens over the bladder or over the bladder, like coughing, sneezing, or while lifting the weight and all, it is a stress. So whenever there is a stress over the bladder, there happens incontinence because of the poor urethral sphincter muscle control or the hypermobility of the bladder or the neck of the urethra. So like that, if the patient is having incontinence, then we termed it as stress incontinence. And the other option was the overflow incontinence. Overflow. So as the name indicates, it is a concept of urinary incontinence which is characterized by the involuntary release of urine from an overfull urinary bladder. Overfull urinary bladder, often in the absence of any urge to urinate. Here there will not, patient won't have any urge to urinate, but when the bladder is overfull, there happens incontinence. So this condition occurs in people who have a blockage of the bladder outlet, like benign prostatic hyperplasia, prostate cancer, or narrowing of the urethra, or when the muscles of the bladder, that is the detrusor muscle, is too weak to empty the bladder normally. Okay, so when there is a problem with the detrusor muscles, or when there is a problem with the outlet, bladder outlet blockage, like benign prostatic hyperplasia or prostate cancer or narrowing of the urethra, there occurs a condition known as the overflow incontinence, in which the urinary bladder is overfull and the patient is unable to control that. Okay, so that is known as the overflow incontinence. And final option was the functional incontinence. So what is a functional incontinence? So this is a form of urinary incontinence in which a person is usually aware of the need to urinate, but for one or the other reasons, that may be a physical or a mental reason, they are unable to get to a bathroom. Okay, so because of a physical problem, like the patient is paralyzed or patient can't get up from the bed and go to the bathroom, patient may urinate in the blood. So in such conditions, we can term it as a functional incontinence. So here the patient know that patient want to urinate, patient have the sensation, there are no other problems. Because of some physical or the mental reasons, he is unable to get into the bathroom and he is passing the urine in the bed itself or where the patient lies. So that type of incontinence is termed as the functional incontinence. Okay, so with this question we are getting information regarding the four types of incontinences. Okay, so with that we will move on to the next question in our series, that is a eighth question. So here comes the eighth question regarding a breathing exercise. So the question is, which type of breathing exercise help relieve splinting from incision or abdominal pain? Okay, so which type of breathing exercise help relieve splinting from incision or abdominal pain? So I am giving you four options of different types of breathing exercises. From that you can find the answer for this question. So the option number A is the segmental breathing exercise. Option number B is the pursed lip breathing. Option number C is the diaphragmatic breathing. And the final option is the lateral costal exertion. So which breathing exercises can relieve splinting from incision or from the abdominal pain? So what is the answer? So I think you have heard about all these breathing exercises. So the answer for this question is option number D, that is a lateral coastal excursion. Okay, so the lateral coastal excursion help release splinting from incision or from the abdominal pain. So I'll be only explaining about the lateral coastal exercises, how we have to do. The other types of exercises you can refer later because we have very limited time, as I told earlier. Okay, so in the lateral coastal excursion, how we have to do is have the patient sit erect on the edge of the bed or in the chair, and the therapist should place the hands over the patient's lower ribs or upper abdomen. Okay, so the therapist will be placing the hands over patient's lower ribs or in the upper abdomen, then instruct the patient to exhale. First, we have to explain the patient to exhale through pursed lips while the therapist applies firm pressure against the patient's rib and abdomen with hands. Okay, so when the patient is exhaling through pursed lip, the therapist will be applying firm pressure against the patient's rib and abdomen with hands, and then the patient has to inhale, pushing the lower ribs outward against the therapist's hand. So therapist's hand will be in the place, and with inhalation the patient should push the lower ribs outward against the therapist's hands. Okay, so the therapist should gradually increase the resistance to this movement as much as can be tolerated by the patient. Okay, so this is a way of doing lateral coastal exertion which can help in relieving the splinting, incision pain or the abdominal pain. Okay, so this is a lateral coastal excursion. So we will see the other options also. I am not going in depth into pursed lip breathing and other thing. So pursed lip breathing, it will help to maintain higher and expiratory pressure in the airways, and it prevents the alveolar collapse and extends alveolar collapse in COPD and all. Okay, so you know that this was the regular question which was asking for the other competitive exams, but JIPMER we can't expect what type of questions will come. Okay, so pursed lip breathing is for the COPD, and how we have to do all those things you can refer later. Then what is a segmental breathing? So segmental breathing means these are used to give support or enhance expansion of the restricted lung in respiratory disorders. So in certain respiratory disorders there will be that restricted lung expansion will be there. So for giving support or to enhance the expansion of the restricted lung area, we are using the segmental breathing, and this technique is meant to have an effect on the variation of stretch mechanism involving the stretch reflex process. So fast stretch on external intercostal muscles bring an assistance in the contraction. Okay, so it is useful in improving the stretch reflex process, so that reflex will be sent to the brain, and there will be a fast contraction will happen. It will assist in the contraction. That is a segmental breathing. So in depth you can refer it later. I'm giving just points. Okay, so next, the final option was regarding the diaphragmatic breathing. So what is a diaphragmatic breathing? It is otherwise known as the abdominal breathing or belly breathing or deep breathing. Okay, so it is a breathing that is done by contracting the diaphragm, as the name indicates, and air enters the lungs as the diaphragm strongly contracts, but unlike during traditional relaxed breathing. Okay, so the intercostal muscles of the chest do minimal work in this process, and the belly also expands during this type of breathing to make room for the contraction of the diaphragm. Okay, so that is happening in the diaphragmatic breathing. So with this question you are getting information regarding the some types of breathing exercises and which all conditions we can use these exercises, that we can refer also. So now we'll move on to the next question in our series, that is the 9th question from GK, and the question is, the Great Indian Novel is a book written by whom? Okay, the Great Indian Novel is a book written by whom? So options are option number A, Arundhati Roy, option number B, Shashi Tharoor, option number C, R.K. Narayan, and option number D, Kiran Desai. So what is the answer for this question? Great Indian Novel. So it is a book written by Shashi Tharoor, and the Great Indian Novel, it is a satirical novel by Shashi Tharoor, first published by the Viking Press in 1989. Okay, so just a simple knowledge for you. Now moving on to the 10th question in our series, and the question is, which among the following anesthetic agent is a hypnotic? So we know that there are several types of anesthetic agents. So in that, which is a hypnotic? That is the question for you, and the options are option number A, propofol, Option number B, fentanyl. Option number C, atracurium. And option number D, glycopyrronium bromide. So, which among these agents is a hypnotic? That's the question. So, what is the answer? So the answer for this question is option number A, that is propofol. Propofol have a hypnotic effect also. So first we will see what is a hypnotic agent. So a hypnotic or a soporific drug, commonly known as the sleeping pills, are a class of psychoactive drugs whose primary function is to induce sleep or surgical anesthesia and to treat insomnia, that means sleeplessness. Okay, so here we were explaining about the propofol. So propofol, it targets the lateral hypothalamus and it generates a hypnotic state which might involve the inhibition of the GABAergic neurons. Okay, so there will be inhibition of the GABAergic neurons by targeting the lateral hypothalamus and thereby exerting a hypnotic state. Propofol is considered to be as a hypnotic anesthetic agent. Okay, so what about the other options? So atracurium, what is the use of atracurium basilate? It is a medication which is used in addition to the other medications to provide the skeletal muscle relaxation during the surgery or mechanical ventilation. Okay, that means the neuromuscular blockade. Sometimes the question may come like neuromuscular blockade can be achieved with the help of which anesthetic agent? Okay, so like that also questions can come. So atracurium basilate is such a neuromuscular blockade agent which can be used during the surgery or during the mechanical ventilation to provide skeletal muscle relaxation. Okay, so the next option was regarding the glycopyrronium bromide. So in who are working in the ICUs and all, you may be regularly using these medications to reduce the secretions. Okay, so this is a medication of the muscarinic anticholinergic group which is used to reduce the secretions. Okay, so this is another answer for another question which can be asked. And the final option was regarding the fentanyl. So fentanyl is a very potent synthetic opioid which is used as a pain medication. Okay, it is an opioid anesthetic agent which is used as a pain medication, that is fentanyl. Okay, like morphine. Okay, so I think that also is clear for you. Now we will move on to the very next question, the 11th question in the series, and the question is from the economics. In the economics, and the question is short-term finance is usually for a period ranging up to. So what do you mean by a short-term finance or a short-term loan? So the options are option number A, only for 5 months, option number B, 10 months, option number C, 12 months or 1 year, and option number D, 15 months. So what is the period range for a short-term finance? So the answer for this question is option number C, that is 12 months. So as we all know that a short-term loan usually offered to firms that don't qualify for a line of credit, and it generally runs less than a year. Okay, so just a small information for you. Now we will move on to the 12th question in our series, and this is from the psychiatry. Very important question. An obsession with healthy eating with associated restrictive behavior is termed as. So the key points in this question are, here the patient is obsessed with healthy eating. Okay, healthy eating with associated restrictive behavior, which is termed as dash. And the options for you are option number A, anorexia nervosa, option number B, bulimia nervosa, option number C, orthorexia, and option number D, pica. So all 4 options what I have given are one or the other forms of eating disorders. So here I have asked about a healthy eating practice with associated restrictive behavior. So what is the answer? So the answer for this question is obviously option number C, orthorexia. Okay, so what is orthorexia? Orthorexia nervosa is perhaps best summarized as an obsession with healthy eating with associated restrictive behavior, which means the attempt to attain optimum health through attention to diet may lead to malnourishment. Okay, so they will be very particular about the food they are eating, like whether that is healthy or not, whether it will harm me or whether it will increase my blood cholesterol level. So I will lead very healthy diet only, like that they will tell, and it can lead to malnourishment because they will take whatever they feel to be healthy. Okay, and there will be loss of relationships and poor quality of life. Okay, so that is known as the orthorexia nervosa. So regularly we are hearing about anorexia nervosa and bulimia nervosa, but this is an additional term that you have to learn. And obviously the other options, that is anorexia nervosa, often referred to as simply as the anorexia. It is an eating disorder which is characterized by low weight, food restriction, body image disturbance, fear of gaining weight, and an overpowering desire to be thin. Okay, so you should understand the difference between anorexia and orthorexia. Orthorexia, the patient wants to have something that is very, very healthy, but in anorexia nervosa, the patient won't take any food, telling that the patient, because of the fear of gaining weight and other problems. Okay, so that is anorexia nervosa. Okay, so what is bulimia nervosa? It is an eating disorder which is characterized by binge eating followed by purging or fasting or excessive concern with the body shape, weight, etc. So patient may vomit, it may induce vomiting after having the food. Okay, so that is known as the bulimia nervosa. So don't be confused with these three terms: bulimia, anorexia, and orthorexia. And the final option was regarding the pica. It is also an eating disorder in which a person eats the things not usually considered food. Okay, you know that especially during the first trimester of the pregnancy and all, the ladies, pregnant ladies, will have this thing, and sometimes in other some children and all, we can see pica, which is an eating disorder in which the person eats things that are usually considered as food, like soil and sometimes like other substances, etc. Okay, so I think that also clear for you. Now we will move on to the 13th question in our series, and it is also a very, very important question. Where is the headquarters of the International Council of Nurses, that is ICN, located? So where is the headquarters of ICN, International Council of Nurses? So the options for you are, it is in Germany, option number B in Switzerland, option number C Canada, and option number D United States. So where International Council of Nurses headquarters located? So answer is option number B, that is in Switzerland, that is in Geneva. So the International Council of Nurses is a federation of more than 130 national nurses associations, and it was founded in 1899. So this is the answer for another question. So ICN was founded in 1899, and it was the first international organization for healthcare professionals. Okay, so this is the answer for another important question. The first international organization for healthcare for professionals is ICN, and it is headquartered in Geneva, Switzerland. Okay, so that also was very, very informative question for you. Now we will move on to the 14th question in our series, and this is regarding your observation. So a patient wound is draining thick yellow material. Okay, so the patient wound is draining thick yellow material, and the nurse correctly describes the drainage as which of the following? Okay, so thick yellow. So that is a key point in this question, and the options for you are option number A is serous, option number B purulent, option number C sanguinous, option number D serosanguinous. So what type of drainage the particular patient has? So that is the question. So the key point, as I told in the beginning, thick yellow material is there. So the answer is, obviously answer is option number B, that is purulent. Okay, so we will see the types of drainage. So the drainage, wound drainages can be, first one is the serous. That means the wound drainage will be clear and it will be very thin and may be present in a healthy healing wound. So the serous drainage can be present in healthy healing wound. Then what is the serosanguinous? Serosanguinous. So the first one is the serous, no? So serum plus sanguinous, that is blood. So it may contain blood also. So that means it may also be present in a healthy healing wound. Serosanguinous can be present in a healthy healing wound. Serosanguinous, as the name indicates, serous plus sanguinous, that is blood also is there. Then what is sanguinous? Sanguinous means primarily it is blood. So you should understand the difference between serosanguinous and the sanguinous. Sanguinous means the primary content of the drainage will be blood, but in the serosanguinous, blood also will be there. Blood also is a part of the drainage. Okay, so that is the difference. So the final one is the purulent. So purulent means it is thick, white and pus-like drainage, and it may be indicative of infection and need to be cultured. Okay, so that is purulent. So it will be thick, white, or sometimes pus-like. That means yellowish, light yellowish, and may be indicative of infection and should be cultured. Okay, so these are the four types of drainages you can be seen from the wound, and the answer for our question is purulent. Okay, so I think this is also this also was very useful for you. Now we will move on to the 15th question, another important, very important question. Hartmann's procedure is associated with which among the following? Okay, Hartmann's procedure. So the options are option number A, loop colostomy, option number B, end colostomy, option number C, double barrel colostomy, and option number D, none of the above. So none of the above. So what is the answer for this question? Hartmann's procedure. So you understood that it is associated with a colostomy. So what is the answer? So the answer for this question is end colostomy. So first of all, we should understand what is a Hartmann's procedure or Hartmann's operation. It is otherwise known as the proctosigmoidectomy. So you should understand one thing, proctosigmoidectomy, that is a removal. So it is a surgical resection of the rectosigmoid colon with closure of the anorectal stump and formation of an end colostomy. So here the anus, anorectal stump, there will be surgical resection of the rectosigmoid colon. Okay, rectosigmoid colon is resected out and that is closed, and the opening is made through colostomy, which is known as the end colostomy. So the end colostomy is associated with the Hartmann's operation. So a stoma is created from one end of the bowel. The other portion of the bowel is either removed or sewn shut. Okay, that is known as the Hartmann's procedure, which is associated with the end colostomy. So what about the other options? What is a loop colostomy? Loop colostomy means this is a type of colostomy which is usually used in emergencies, and it is a temporary, and it is temporary and it contains a large stoma, and the loop of the bowel is pulled out onto the abdomen and held in place with an external device. So the bowel is then sutured to the abdomen and two openings are created in one stoma. Okay, so in one stoma, two openings will be created, one for the stool and the other for the mucus. So that is a loop colostomy, which is a temporary colostomy, and it contains a large stoma with two openings, one for the stool and the other for the mucus. That is a loop colostomy. Then what is a double barrel colostomy? So as the name indicates, the bowel is severed and both ends are brought onto the abdomen. Okay, so the both ends are brought onto the abdomen, and definitely so there will be two openings will be there. One will be the proximal stoma and the other will be the distal one. So here only the proximal stoma is functioning, and most often the double barrel colostomy is of temporary colostomy with two openings, distal and proximal, and the elimination occurs through the proximal stoma. So this is the answer for another question which can be asked, like in the double barrel colostomy, which stoma will be functioning, so from where the elimination occurs. So distal, proximal, both, like that question can also come. So the proximal is the answer for the question. Okay, so the final I think with that that question is getting finished. Now we will move on to another GK question regarding the sports. Durand Cup is associated with the game of dash. Durand tournament for what? First of all, cricket. Second option is football. Third option is hockey, and final option is volleyball. So Durand Cup is associated with the game of option number B, that is football. So Durand Cup tournament, known as the Durand Cup, is an annual domestic football competition which is held in India, first conducted in 1888 in Shimla. Okay, so just a small information for you. Now we will move on to the 17th question in our series regarding the dietary fibers. The question is, which among the following is not a soluble dietary fiber? So the question is, which among the following is not a soluble dietary fiber? Options are option number A, beta glucan, option number B, psyllium, option number C, inulin, option number D, lignin. Okay, so which among the following is not a soluble dietary fiber? Not. So the answer for this question is option number D, that is lignin. So I will be explaining about the different types of fibers, like soluble fibers and insoluble fibers, and some examples. So soluble fiber, otherwise known as the fermentable fiber or prebiotic fiber, these are the fibers that dietary fibers that you used to consume daily. Okay, so soluble fibers, otherwise known as the fermentable fiber or prebiotic fiber. As explained, this is dissolving in water and it is generally fermented in the colon into gases. So these fibers will be fermented in the colon into gases and physiologically active byproducts such as short chain acting fatty acids, then produced in the colon by the gut bacteria. So gut bacteria is necessary for the fermentation of the soluble fibers, and the examples are beta glucan, which can be seen in the oats, barley, mushrooms, etc. Then psyllium and inulin, which can be seen in the chicory root, etc. Okay, so these are the examples for the soluble fibers, and why it is soluble and why it is known as the fermentable means that already I have explained. Okay, so why I am explaining this is any areas questions can come. Okay, so what is an insoluble fiber? Insoluble fiber, as the name indicates, does not dissolve in water and it is inert to the digestive enzymes in the upper gastrointestinal tract. Okay, it is inert, there is nothing will be happening there, and examples are wheat bran, cellulose, lignin, etc. Okay, so this will increase the bulk in the in the stool. Okay, for constipation patients and all, we can advise this type of foods. So the chief sources of the dietary lignins are various vegetables and fruits, legumes, whole grain cereals, oil seeds, etc. Okay, so these are the examples. Okay, so you are getting information regarding two types of dietary fibers, that is soluble and insoluble, and some examples, dietary examples. Okay, so moving on to the 18th question, and this is from the nursing education, and the question is: education is a social process. Education is growth. Education is not preparation for life, but is life itself. So these words are whose words? Whose words are this? So this is a definition given by one of the authors, very famous authors, and the options are: option number A, Mahatma Gandhi; option number B, Helen Keller; option number C, John Davy; and the final option number D, Bertrand Russell. So education is a social process, education is growth, education is not preparation of life, but it's life itself. So it was quoted by John Davy. Okay, so what Mahatma Gandhi told about education is that there are nearly 19 to 20 quotes regarding the education, which was explained by Mahatma Gandhi. But the famous thing is by education I mean an all-round drawing out of the best in the child and man, body, mind and spirit. Okay, so this is a quote by Mahatma Gandhi. And by the Helen Keller, education should train the child to use his brains to make for himself a place in the world and maintain his rights even when it seems that society would show him into the scrap heap. Okay, so you know the history of Helen Keller and all, that you can refer later. Then the final option was regarding the Russell. So according to the Russell, education is a process of self-development. Okay, so question can come like this: education is a process of self-development. This was quoted by whom? Like that questions also can come. Okay, so with that we are finishing that question. We will move on to the next question in our series, that is the second last question from GK. Which is the national aquatic animal of India? National aquatic animal of India. Land animal alla, not land animal, aquatic animal. So the options are: option number A, river dolphin; option number B, Ganges shark; option number C, mugger crocodile; and option number D, tortoise. National aquatic animal of India. Option number A, river dolphin, is the answer for the question. So the reason why to declare the Ganges river dolphin as the national aquatic animal of India was to save it from the extinction. Okay, so also the Ganges dolphin is seen as the reflection of the health of the Ganga river. Okay, so that is the reason they are considered to be as the national aquatic animal. Moving on to the last question in the series, the very last question, and the question is: the causative of tuberculosis produces tuberculin. That you know, that is a tuberculin. So what is tuberculin? It is a or an dash. So that is a question whether it is an enzyme, or it is a hormone, or it is an endotoxin, or it is an exotoxin. So what the tuberculin is? We know that it is a purified protein derivative which can be used for the diagnosis of tuberculosis. Those things are very, very important. But here the question is, what is a tuberculin? Whether it is an enzyme or hormone or endotoxin or exotoxin. So the answer for this question is obviously, answer is option number C, that is an endotoxin. Tuberculin is an endotoxin. So classically the bacterial toxins are divided into two, as the exotoxins and endotoxins. So while endotoxins are membrane compounds of the gram-negative bacteria which elicit an inflammatory response in the host. Okay, so it will be within the membrane compounds of the gram-negative bacteria. So as the name indicates, exotoxins, they will be secreted proteins which act locally and at distance of the bacterial colonization site. Okay, at distance of the bacterial colonization site. So there is a difference between endotoxin and exotoxin. Okay. So with that, we are coming to the end of this session. So we have in detail we have explained about the 20 questions, and I am not telling like definitely we can expect the same questions for the exam, but these are some clues for you where you have to prepare more, where you are weak. Those things you only can identify. So I think these questions will help you to prepare well for the exam. So once again, thanks a lot for watching our video till the end, and I request everyone to be in touch for the next video to come. So till that time, study well, best wishes, signing out. Thank you.